top health official says is a disturbing surge in COVID-19 infections. Now the healthcare heroes going wherever the virus takes them. Their latest battleground, Arizona. Here's ABC's Matt Gutman.
So today is my first day on the floor on my own.
It's exciting, but it is a little bit scary.
Bridget Harrigan has answered the call before. Hospitals overwhelmed with COVID-19 cases are desperate for help from people like her.
Be putting me in the COVID units the whole time, so I'll want to be just dressed up for that before I even get in the building.
I was meant to go to help on the front lines in some way.
The traveling nurse has seen what the coronavirus can do to a city. She has dedicated herself to fighting this pandemic, starting in New York City.
My hospital was full of patients, full of people. I've been to hospitals before where the census was overflowing, but this was on a whole nother level.
And as Arizona reaches its highest number of cases ever, she knew that this was her next destination. And today, with thousands lining up to cheer President Trump at this mega church in Phoenix, Dr. Sam Durrani, who heads COVID response for a hospital system here, was shocked by what he saw. And all of this as his hospital system, he says, is seeing an alarming rise in hospitalizations just over the past 24 hours.
You're talking about 10% increases per day, 20% increases in hospital admissions.
So what does that mean for hospitals like yours?
You're going to get to the point where we have overflow, especially in the ICU.
But the president's supporters dismissive about mask wearing.
The person feels like they don't need to wear a mask. I don't think that they should be forced to wear a mask.
Are you potentially putting the lives of Americans at risk by continuing to hold these indoor events? Cases in Arizona are spiking, sir.
Yeah, no, I don't think so. I don't know how they have it set up, but I'm going to Arizona. It's a great place, great state.
In his swing through the Southwest, the president hoping to firm up support in the increasingly purple Grand Canyon state. First making a stop at the U.S.-Mexico border. And just miles from where the president was, overwhelmed hospitals calling for every available nurse in the region and for volunteers from out of state. From coast to coast, travel nurses descending on Arizona, deploying for duty on the state's front lines.
Hospitals are starting to get filled up to capacity.
Houston-based ICU nurse Shannon Roberts flew to Phoenix for a 6-week contract.
So I really just go in with no expectations. I just go in knowing that I'm going to have sick patients and knowing that I'm going to be there to take care of them.
Dina Jester Mitchell drove cross-country from Oklahoma to Arizona in her RV.
Arizona,
her boyfriend and 2 dogs along for the ride.
Woo! You can call it a service, but this is my life. This is what I do.
This will be her first time working with COVID patients, but she says her 8 years as a travel nurse have prepared her for the worst.
I would rather somebody die with me sitting right there, holding their hand. Excuse me. I would rather hold their hand and get them through their journey than to have them die alone.
Bridget Harrigan knows firsthand how bad it can get. She just wrapped up her last travel assignment in New York City, the epicenter of the pandemic, and she spent a month working in the ICU of Elmhurst Hospital.
When I got there, it was like a disaster zone. We were treating it just like you learn as a nurse how you do disaster nursing and triage and everything.
By early March, the hospital in Queens becoming ground zero, seeing as many as a dozen deaths in a 24-hour period from the virus.
I've never experienced 5 to 10 deaths in just a shift before. I've never experienced that gravity of the situation. It's physically taxing and emotionally taxing. This is my decontamination station, as I like to call it.
Now ramping up in her new role, Harrigan is doing everything in her power to keep herself and others safe.
Seeing it, in my opinion, as bad as it can get, and hearing that there's a possibility that somewhere else is headed that way, that compelled me to come and help.
We are reaching a point we may not be able to take care of every patient to the best of our ability who comes into the hospital.
Dr. Jennifer O'Hay works in the critical care department at Banner Health in Phoenix. For months, she's been in the trenches helping patients fight COVID-19. She considers one thing critical to thwarting the virus.
If I could ask everyone to do one thing to stop the spread of COVID-19, it would be to wear a cloth mask in public.
O'Hay joined 1,000 doctors signing this letter demanding the governor make it easier for local leaders to mandate mask wearing.
I was so disappointed to see the lack of masking and social distancing that is so easy for the community to do in this public health crisis.
One of the state's biggest tests for whether Arizonans are heeding the call to wear masks came in the form of that rally for President Trump.
Anybody worried about masks? No. You're one of the few people out here who I've actually seen wearing a mask.
Right.
Why?
Well, I'm in the group of over 65 or 65 or over, and I have asthma, and I'm a disabled Vietnam-era veteran.
All right.
And I figure it'd be smart.
Yeah. Do you have a mask? Did you bring a mask?
I have one with me.
Okay. Are you going to wear one inside?
No, not unless required.
Ahead of the president's arrival, the mayor of Phoenix releasing a statement yesterday saying everyone attending tomorrow's event, particularly any elected official, should set an example to residents by wearing a mask. This includes the president. Dr. Durrani, the COVID response chief for Honor Health, was so shocked by the lack of masks, he started snapping pictures.
Definitely at least 1,000 people here. What percentage of them would you say are wearing a mask?
About 1% to 5% probably.
In a city that's going through its surge right now, what does that mean?
Well, it's not good. You know, any mass gathering right now is going to propagate the spread of COVID-19.
Here we are on our way to see our President Trump.
Nadia Larson was determined to see the president in Arizona today, waking up at 5 a.m. to be one of the first in line at the rally with her friend and fellow Trump supporter. Though she's considered in a high-risk category for COVID as a breast cancer survivor, Larson is not planning to wear a mask at the rally.
I fight any viruses with my supplements, the vitamins that I take, all 5 of them every day. I take my CBD, I de-stress, and I stay in the sun every day for 10 minutes to kill the virus. My immune system is strong, and if I get sick, I get over it.
Tonight, she cheered on the president, both of them not wearing a mask.
We're doing so well after the plague. It's going away.
And as Bridget Harrigan comes off her shift, she says she's hopeful that the crisis she saw in New York won't become reality in Arizona. But she is ready.
I've been there for one shift in the hospital, and it's not as bad as New York, but it has every capability of getting there if the cases rise and it overruns a hospital. So I'm hoping that that doesn't happen while I'm here, but if it is, that's what I'm here for.
For Nightline, I'm Matt Gutman in Phoenix, Arizona.
Get to click subscribe and bell button.